Medicare is federal health insurance, and it's designed for people who are 65 years old or older, or who have particular medical conditions or disabilities. I just want to talk about for a moment those of you who are 65 years or older or are about to become 65. So if you are working, you want to make sure you go ahead and talk to your HR department about whether or not you're going to be required to get on Medicare, because there are certain deadlines you want to make sure that you meet. If you are not working, you are going to sign up for Medicare somewhere between 3 months before your 65th birthday or 3 months after your 65th birthday. I strongly encourage you not to drag your feet on this. You're going to have to make decisions about whether or not you take traditional Medicare or whether or not you take Medicare Advantage. And if you take traditional Medicare, there's going to be some decisions about what you're going to do for Medigap policies and Part D as well. So you want to get a head start on this. Usually I tell my clients that they should go ahead and get started on this somewhere around their 64th birthday or 64 and a half. That way they give themselves a nice runway to go ahead and figure this out. If you are working, it might be that you stay on your employer's coverage, and you will continue to do that until you what we call separate from service. In other words, leave your job, whether they ask you to or you do it voluntarily. So if you are approaching 65 years old, you need to be having these conversations now so you don't miss deadlines and you don't run into penalties that might last your lifetime. I'm Jessica Lanning. Lanning Does Planning.